Alright, so this video is to show nasopharyngeal airway sizing and insertion. First we'll look at it from the side view so that we can see how to measure it. For sizing, it measures basically the same method as the OPAs or the oropharyngeal airways, except we're measuring from the nose to the earlobe or angle of the jaw and not the mouth. So it's kind of easy to remember. Just remember what device you're putting in and that's where you'll start the measurement from. So you can measure from the center of the nose to the earlobe, or you can measure from the side of the nose to the angle of the jaw. There's a couple different styles. This particular style is called the Trumpet. It's got the flange on the outside to help direct air and to completely occlude the outside of the nose when it's in. We'll take a look at this one, and that's about the right size, so we could use that one. See, this one too is going to be a little bit too long, but the nice thing about these is it's got the adjustable flange. So we can adjust it down to actually make it the right size if we wanted to use that one. You also have to be careful about the diameter. In this case, this one is way too big for this guy's nostrils. You can measure the diameter by looking at the patient's pinky, and it will give you an idea of the size of diameter that you'll need to use for the NPA. So we'll discard this one. This is going to be too big for the nose. This one here is just about the right size. I can probably adjust it down just a little bit and get a proper fit. So we'll go ahead and use this one when we insert it. I like the adjustables because as long as it's the right diameter, I can adjust the depth that it's going to be inserted. Alright, so this is the front view of insertion of a nasopharyngeal airway, or NPA. We've already sized it properly. Remember, when you take these out of the packaging, you do need to lube them up real quick. So you'll need some water-based lubricant, such as KY or something like that, to lube it up. Remember that it is dry rubber going into a mucous membrane, so the extra lube will help pass it pretty quickly. You always want to start in the right nostril first. A couple reasons for that. The right nostril is just a little bit bigger than the left, so you've got an easier chance at passing it the first time. And then you also want to start with the bevel towards the septum. So this part down here is the bevel, and the septum being the middle of the nose. So anatomically, you can see that it's got a natural curvature. So bevel towards the septum in the right nair will follow the anatomical position very easily. So we're going to insert this. Typically, when you meet resistance, you don't want to force it in. You want to pull it back out and try the other nostril. In this case, I'm meeting just slight resistance only because I'm trying to insert this on a rubber mannequin. So it is in the airway. Remember, if you meet resistance, go ahead and take it back out. Try the other nostril. You will notice, though, with the other nostril that the bevel will be away from the septum. So don't think that you need to put bevel towards the septum. If we were to do that, you would actually be inserting it upside down. And with that being said, too, if you're suspecting that your patient has a basilar skull fracture, you don't want to use an NPA. It's a contraindication for a nasopharyngeal airway, as it may get lodged into the brain.